Thank you, Madam Speaker. I rise to address the House for 5 minutes and arrive
without objection.
Thank you, Madam Speaker. The report of the Chief Actuary of Medicare is in, and as we thought, it shows real problems with the idea of expanding Medicare coverage to lower age groups. This summer, I had an opportunity to do a bunch of town hall meetings, and in those meetings, we discussed the fact that what we're talking about really is, in the public option, is adding more people to something like the SS Medicare, which is already sinking in the harbor. But now, over in the other body, there's specifically a proposal to literally add more people to the sinking SS Medicare in the harbor. And so in the last several days, the Chief Actuary has provided a report that really should stop us in our tracks and cause us to realize that that's no solution to add people to a program that is already unsustainable. So what that Chief Actuary of Medicare reports is this: that the savings, several items in his report obviously, but one of them is that the report cautions that savings needed to extend the trust fund cannot simultaneously be used to extend other health insurance provisions and other health insurance coverage. In other words, if you're going to save money, you can't simultaneously expand coverage under the program. It seems fairly obvious to the folks I was talking to in town hall meetings. Unfortunately, here in Washington, it seems not to be comprehended. We seem to think that here in Washington we can continue to add people to a program even though the people that are currently on the program have it on a trajectory that can't be sustained. So the actuary also points out that actually the Senate bill would increase the cost of health care, would not decrease the cost of health care. In fact, total spending on health care would increase by $234 billion between 2010 and 2019. Also, total federal expenditures on health care would increase $365.8 billion during that period. The bill would extend coverage to 33 million Americans by 2019, but would still leave 24 million people uninsured, 5 million of which may be illegal immigrants. And the number of people with employer-sponsored health care would drop by 5 million by 2019. So what the Chief Actuary is telling us is that the solution that's being proposed is not a solution. In order to solve the challenge of Medicare, you have to figure out some way to change the underlying behavior. You have to figure out a way to get the patient invested in their care and caring how much it costs. That's what we've got to do for Medicare, Medicaid, and for private insurance. There's some very creative things going on in the private sector that are toward this end, to have this objective of changing the underlying behavior. But what we're discussing here in Congress under the majority here in the House and the apparent majority over in the Senate is not something that will change behavior. What it will do is simply add more people to a program that is already unsustainable. So rather than saving money, as the President suggests it will, actually what will happen, as the Chief Actuary says, is a cost rise. Not everybody gets covered. It's clearly not a solution. So what we have to do is scrap the current plans and go back to something that might actually work by getting a change in behavior, by figuring out how to get people covered, by figuring out how to do medical malpractice reform, and by getting 50-state competition among private insurance companies. Those, Madam Speaker, are the solutions that we want to see in this country. We must stop this false solution that's being offered now. I thank the gentlelady and I yield back.